Thank you very much and welcome to the conference today, Older People in Social Care and Getting the Right Approach. And this indeed is our second annual conference that we've run in partnership with ARC, and Paul, you'll hear from just in a little while, and it's very much about developing information and sharing approaches across all sectors, which we have here today. This year we're focusing on two of the most important issues of concern for older people. It's how to achieve dignity and rights for older people in areas of health and social care. We're delighted to see such a wide range of interest in the audience today. We have our older people's groups and representatives, age networks, statutory colleagues, independent sector colleagues, and those with our regulatory requirements, and also some of the world's academia. So it's surely a reflection of the importance and interest of us all today in the key topics of rights and dignity. What we do know is that many older people do indeed live lives which are dignified, fulfilled and engaged, but sadly there are others who do not. One of the key things that came to light with us at a research last year was in terms of over 10,000 of our advice calls coming through the advice line. Over 10% of them were directly linked to health and social care issues. That's, I say, over 3,500 calls directly linked to the concerns people had about primarily their social care needs, care at home, care if they needed to go into residential or nursing care, and also a percentage of those obviously in terms of health. AgeNI promotes a rights-based approach to ageing. At the core, that simply means that we believe through all stages of our lives we should be treated with dignity and respect. Nowhere perhaps is this more noticeable than in the area of health and social care, and again a topic which I think will be hotly debated today. Our approach and our vision on social care is one where older people now and in the future have a quality, integrated system based on and recognises the rights and the respects and the aspirations and indeed the diversity of us all. At the heart of our vision is a system that enhances well-being and independence so that older people can continue to engage socially and maintain self-esteem, dignity and purpose in all that they do within our communities. And participation is an essential component of that and delivering dignity and respect, and particularly in health and social care. And in your packs today, there is a little leaflet called Expert Age, and Maura is here today, and you can see her in terms of the breaks. And Maura will share with you some of the work that our Expert Age panel has been delivering in terms of ensuring participation and voice, particularly in services such as residential and nursing care, and the impacts of getting the voice of older people in the decision-making, in decisions about their care. We'll also hear today from two older people who share their direct experiences of the challenges they faced in accessing health and social care. I know that there are also a significant number of older people in our audience today who will also mirror some of the findings and some of the experiences that you will hear later on, not just directly through concerns that you may have, but also in terms of loved ones, neighbours and family and friends who, certainly when I'm going around a lot of the networks, we will hear there's a neighbour or there's a friend who has had an experience that hasn't been what it should have been. Evidence is clear in terms of age discrimination, that older people still do face widespread discrimination. Ageism and that discrimination challenges the dignity and the rights of older people in Northern Ireland. AgeNI has been campaigning for legislation to be introduced along with a number of partners to ensure that it's removed from what happens in Northern Ireland. Age is the only grounds where it is still legal to discriminate in accessing goods, facilities and services in Northern Ireland. And we do remain hopeful that the Northern Ireland Executive will deliver a programme for government with a commitment to legislate in this area. I can't certainly not come to a conference nor mention at a conference 3 letters, TYC, and indeed the follow-up report, Donaldson. So TYC, Transforming Your Care, and Donaldson have set a journey and a road and a map for us to change how health and social care is delivered. What we need is implementation so that all of us can have a world-class healthcare system that we're all proud of. And what we do, and what we also need, is an investment in low-level preventative services. And what we definitely don't want is the remainder of 15-minute calls. And in some cases, what has come through our advice lines has been the ask for an 8-minute call for domiciliary care. Moving on to that domiciliary care, there's been significant work carried out through research with AgeNI and indeed a document soon to be launched with the Commissioner in terms of the impacts of domiciliary care on older people are reviewed and shared, the experiences and also some of the ways forward which we can build a better service in terms of putting the social back into social care. And that's placing greater emphasis on promoting dignity of older people for those who provide care and also those who have that care provided to them. Loneliness is something that's very dear to us all in AgeNI. Over the next couple of months, we want to have a push and an emphasis on what that really means in Northern Ireland. What we have heard from research is that loneliness and isolation is one of the top issues experienced by older people in Northern Ireland living in their own home. Our research tells us that that's 1 in 3 people have only got the television for company at home. What we also know is that there is a postcode lottery for services provision and access to services sometimes dependent on a trust area. And indeed we have some evidence that in terms of care at home, it's not by a brokerage system but much more by who can deliver it, and that is also dependent of course on whether there's staff in an area, whether it's a rural area and the length of the call. One of the other things that's important to us is legislation, and what we're very aware of is that it's a patchwork of legislation in terms of health and social care and in particularly adult social care. So it's time to review legislation and consolidate. And AgeNI agrees with the Commissioner for older people in that any new legislation needs to be based on the principles of human rights. So today we've got a range of interesting speakers from Wales, Scotland, England and key stakeholders in Northern Ireland. We hope that these inputs will lead to a stimulating conversation around not only identifying where our challenges are, but crucially how we can stretch ourselves to look at how we can create solutions, but also take opportunities when they fall to us. Today, we want to have the dignity and respect for older people as our starting point. And AgeNI believes that placing older people at the centre will enable us to arrive at solutions both today and tomorrow. I hope you welcome and enjoy the conference today. Thank you very much.